Hi everybody, a paper just came out of BMJ, the British Medical Journal, which is a well-respected peer-reviewed journal, entitled Rapid Resolution of COVID-19 After Fecal Microbial Transplantation. And this, alongside some of the other research I've highlighted, only continues to bring to light this gut-lung connection and what you can do for your gut health to help prevent you from getting a severe symptoms from COVID-19. So I'm Ashley Oswald. I'm a registered dietitian and founder of Oswald Digestive Clinic, where we help people improve and often eliminate bothersome gut issues like gas, bloat, diarrhea, and or constipation. So let's just go ahead and dive right into the topic today. Let's start by talking about what is fecal microbiota transplantation, otherwise known as FMT, which I'm going to use in this video because it's a tongue twister if I say it the full name. So FMT is basically taking somebody else's stool or their microbiota, their microbiome, all those bugs living inside of your gut, mostly in your large intestine, the bigger intestine before it comes out in stool. So it's taking the stool of somebody else and putting it into you or whomever is getting the FMT, because we're finding that it's more effective than just giving a probiotic supplement. Because if you think about it, if we're giving somebody else's stool, like a healthy donor, then it's more likely to adhere because you're getting all the diversity that you're not going to be getting in just a probiotic supplement. And so the FDA has only approved this for C. difficile infection so far. This is a really severe reoccurrent bacterial infection that if somebody gets it, they're then put on antibiotics. The antibiotics, may or may not work, but it's such a high chance of reoccurring. They have to keep using antibiotics. Over time, the bacteria become resistant to those antibiotics, and these individuals can get really severely malnourished. And so with FMT, there's a 90% success rate for a relatively low risk. There's no risk to FMT, where there is a FMT transfer and the donor individual had E. coli in their stool because they were doing the transfer kind of under the table, maybe like in a home setting, which is starting to happen because it's only approved for C. diff and in research settings. So the individual ended up getting this really bad E. coli infection and passing away. So who donates then? When thinking about a healthy donor, and when we're doing it in the research setting or in the clinical setting with C. diff, it's a really important screening process, and it goes through the lab. And this stool, we make sure that it doesn't have these aggressive pathogens in it that could then cause more issues than maybe even the C. diff. It could put the person over the edge and that could cause death. And so practically, how is this even done? Basically, and this is how it started, by just a small bore NJ tube, that means nasal to jejunal, so that middle part of the intestine, usually we take it through the first part of the intestine and the tip lands there. So it's all the way down the esophagus, through the stomach, past the pyloric sphincter into the small intestine. And why we would want to do it into the small intestine is because if we're putting somebody else's stool in your stomach, like, you might be able to taste it and that might be kind of disgusting to you. I actually used to place these tubes, kind of a fun fact about me, when I used to work in the intensive care units. So it's maybe something like that small, and they just will drip the stool through that tube, because you can't just pour in those really small tubes. You can drip it at maybe 100, 200 milliliters an hour until it's all in your small intestine. It's going to make its way down into the large intestine. Now they are coming out with capsules, and the funny name for it is crapsule. The stool is inside of this capsule and you just swallow it, and it has a coating that's meant to withstand stomach acid, so then it can make it down into your large intestine without you tasting it, again into the large intestine, and where it can really have its benefit to help to change your microbiota, hopefully for the better. And when thinking about for each individual person who's going to get FMT, what kind of donor we should use for them, things like age and sex and that donor's medical history, their overall health, and all in relation to who's going to be getting it. So age, try to find somebody of similar age, is all taken into consideration because we honestly just don't quite know yet. When it comes to the microbiota, you can think of like an iceberg, and we just know the tip of the iceberg. And that's why I always say, if these probiotic companies are telling you and making these claims that like ours is the best, it's going to cure all these things, we don't know that much information as a community yet, but we know enough to be able to help people feel better. Like, look at this FMT being able to cure C. diff infection for people. That's powerful. But as far as all the details of what's going on, the microbiota, we have trillions and trillions of bugs in there, and we just know the tip of the iceberg. But they do their best, and they try to fit an individual with whom they think a healthy donor would be similar to them. And this is a good spot to bring up the conversation of if you need to be put on an antibiotic for something, please ask your healthcare provider if it's really necessary. And we made a video about this up here. I would really encourage you to watch this. And then if you absolutely have to be put on antibiotics, we talk in that video about what probiotics to consider to decrease your likelihood of certain symptoms from that. So FMT, as you know now, it's approved only for C. difficile infection, but in the research setting, they are now exploring how it might help with IBD, which is inflammatory bowel disease, that's Crohn's, ulcerative colitis, with IBS, irritable bowel syndrome, with colon cancer, and even with autism and obesity. And we're still learning how this is going to affect somebody long term because it's still pretty new. So stay tuned for that. And that's where they're being more cautious before they just approve it for all these other diseases. Now, is it safe to do at home? Because it's only approved for C. diff, some people are doing FMT at home, but is it really safe? So maybe, but remember that story I just told you about the individual who was doing it at home? The stool had E. coli in it, and the person ended up dying because that E. coli actually overtook their gut. And if somebody's trying this at home, they likely don't have the healthiest immune system the way it is, and it might mean that they're at higher risk of having an issue with doing this home FMT because it comes down to the stool just isn't tested. If you're taking stool from a family member that seems healthy, it could be fine. You would assume it's fine, right? But it might just be that that person's healthy enough. And if they have too much E. coli in their gut, they're not having a reaction to it in the way that you might because you have inflammatory bowel disease. And I want to tell a story of a teenager that came to me many years ago with ulcerative colitis, and they had done FMT at home with his sister's stool. And thankfully, nothing happened. Actually, nothing happened, no benefit either. And upon digging deeper into the possible root causes of his gut issues, it came to light that there's a lot that we could do from a functional nutrition approach. And so I share this because sometimes symptoms aren't all the time symptoms aren't a medication deficiency. That's not getting to the root cause. And certainly FMT can be really helpful in those severe instances, but with chronic gut issues, there's often other things that we can do to make a significant improvement before trying to do this just quick fix, I think is what people are wanting with this online FMT. Or they're just kind of to the end of their rope and they're really anxiously waiting for this to be approved. And I'm sure if you look online, there might be options for you to maybe get into some of these research studies, like for the IBD, Crohn's, ulcerative colitis, etc. Okay, Ash, that's cool, but I thought we were going to be talking about COVID. Okay, we are going to talk about COVID now, and I want to share that paper that just came out of BMJ, but I thought it was important to give you a little bit of background because this is all about FMT and how it was used for C. diff for 2 individuals in the hospital setting. They ended up getting a diagnosis of COVID-19. They had risk factors for getting severe COVID-19, and they didn't. So they didn't. And that alongside the other papers that have come out, some of which I've already shared on this channel, really highlight how there is this gut-lung connection. And if somebody's having chronic gut issues or if they're at risk, it could be why they're getting a more severe COVID-19 reaction. And for you, this is going to be good news again, because there's things that you could do to improve your gut health to decrease your risk of getting severe COVID. So let's talk about what these two cases are, so you just have a little bit more information, and I'll kind of wrap it all up at the end. So the first individual was an elderly 80-year-old male with multiple comorbidities, really frail, right? Really high risk of getting severe COVID. He didn't even get severe COVID. He got COVID, but he recovered pretty quickly. And the other is a 19-year-old male with ulcerative colitis on immunosuppression, so a medication suppressing the immune system. So you would expect because of that, he would also have a severe reaction, but no, he recovered really pretty quickly because, again, they both had FMT for this C. difficile infection that they had. And so it really brought up the question among these providers of how is it that the FMT, the stool that we're putting into their gut, how is that modulating the immune system and then that gut-lung connection to where these individuals aren't having the severe cases we would expect them to have. And it makes sense because 70% of our immune system is in our gut. And I will also link here that video that we did on the gut-lung connection. It was a full long 1-hour interview I did with a woman, a dietitian over in Italy. And we really go into some awesome information that I think that you probably wouldn't have heard before. So long story short, because of this, the providers and these researchers decided we're going to do a bigger trial about FMT for COVID and see what more we can find out, which is music to my ears because now we're kind of getting to more root cause, right? Instead of saying, we're just at a loss. If you get COVID, just hope for the best. We know there's things that you can do, that we can do, so that we don't just have to hope for the best. We can say, wow, I actually really, my hypertension is well managed, or I worked with a functional dietitian and I actually reversed my high blood pressure or reversed my type 2 diabetes, or I made so many improvements that I'm on half the insulin I used to be on, or my gut is really healthy now. I'm not having those bothersome symptoms I used to have. And all of that is going to hopefully make you say, if you end up getting COVID-19, I'm more likely to be fine from this because I prepared over here. Obviously, I'm really passionate about that conversation because it's not happening as much as I think it should. And a really quick story to leave you all out is, as you might know or might remember, maybe don't know, I was in Bali in early 2020, and I got dengue fever, which is a virus, and somebody convinced me to kind of go into the doctor. They actually gave me nutrients like echinacea and vitamin C. It was a combination supplement to help support my immune system to fight the virus. That was like their main treatment because there's not like a vaccine for this. There's really not anything else you can do. You just have to wait out the clinical course and allow your body to fight it. So it's really important that you have a strong, healthy body and immune system. And so that's something that we really, really have to keep to the forefront of our mind, especially if you're getting really concerned about these new strains of viruses, et cetera, et cetera. So anyway, if you want more support with your gut health, you can join our Heal Your Gut course, where that is really the foundations of gut health. We have a free masterclass, 5 steps on how to improve gut health. You can sign up at the link below, and if you want to join the course, I have a really great deal at the end of that masterclass. Or you can just book a free call with our clinic if you want to get right down to it. I'm struggling with type 2 diabetes. This is what I'm doing. This is my medical history. We review it all, and then we can work with you and get a personalized nutrition plan going right away. So I want to thank you all. I hope this video was helpful and interesting to you. If you haven't already, subscribe, hit the bell next to the subscribe button to be notified of our new videos every Tuesday at 3 p.m. Central Time, and I will see you next week.